Welcome back. Dr. Rebecca Karlsdottir is a bariatric surgeon for Northern Light Surgical Weight Loss. Thank you so much for being here.
Thanks for having me.
There is a lot of discussion about body shaming these days, and people should feel comfortable with their body no matter what, but the real issue that you're concerned with is obesity. Is that correct?
Correct. I mean, there's a lot of serious health issues that are associated with carrying excess weight. Issues like type 2 diabetes, high blood pressure, sleep apnea, arthritis, and even things into liver disease and certain types of cancers. We know it's not just a number on a scale. We know that it's the effect that carrying excess fatty tissue has on the inflammatory and the hormonal responses in the body, so that's what we're trying to address.
What's the difference between being overweight and obesity?
Yeah, so we define that by something called the body mass index, or the BMI, that's measured and calculated based on your height and your weight. It's not a perfect tool by any means because it doesn't take into account body composition and muscle mass, but it's kind of the simplest tool we have. And you can look online and there's multiple calculators that'll tell you what your number is. But for example, a person with a BMI of greater than 30 is considered to have obesity.
Now, BMI may help determine if the criteria for weight loss surgery. What other criteria are there?
So typically our patients have at least 70 to 100 pounds to lose. They've often tried multiple times throughout their life to lose weight through diet, through exercise, and not achieved long-lasting success, so that they're really ready for a big step, but towards an overall healthier life.
If someone's interested in weight loss surgery, what happens next?
A good way to learn more about it is to go to our website. There's a 20-minute instructional video. It kind of tells you about the pathway towards surgery because it's a tool. So we work with registered dietitians, behavioral health, mental health professionals. We work closely with physical therapy. We have peer support groups, and all of this is to create a whole that supports you before, during, and after surgery.
What kind of surgeries are available?
We typically perform two types of surgeries here. The first one being the gastric sleeve or sleeve gastrectomy. That's the most commonly performed weight loss surgery in the United States today. We remove about 80% of your stomach. You leave you with a long, skinny stomach shaped like a banana. The other one is called the gastric bypass, where we create a small pouch out of your stomach and then bypass the first part of your small intestine. They both work by making your stomach smaller, but also by impacting the hormones that we kind of talked about, so that you feel less hunger, and it kind of works with the gut hormones. We do both in a minimally invasive robotic surgical fashion, so smaller incisions, less pain, and people typically spend one night in the hospital before going home. What
about payment? Do insurance companies cover weight loss surgery?
Yes, many insurance companies do cover weight loss surgery. Some have different criteria where you have to demonstrate weight loss attempts or dietitian visits, but our office is very experienced in going through those things, so if you have any questions about insurance coverage or about the program at all, we're happy to help.
And where should folks go to learn more about weight loss surgery if they have more questions for you?
Yes, so we have our website, northernlighthealth.org /SWL, that's for surgical weight loss, and then you can call our office at 973-6383.
Very interesting stuff. Thank you so much for stopping by.
Thank you for having me.
All right, back with more right after this.